Now moving on to the next topic, guys. In the pelvis and perineum topic, we are going to discuss about one of the visceral organ here, that is a urinary bladder. Certain important points which are required for your exams, which are being tested, guys. So when you study about the urinary bladder will be something like this. You can just make your hand like this and try to remember. There'll be apex, and I told you the apex of the urinary bladder will be attached to the median umbilical ligament, and then here will be the neck here. There'll be a neck, and this will be the base or the posterior surface there. Then superior, and these are the inferior surfaces. So there'll be apex and there'll be a neck, and in the males near the neck of the urinary bladder, you'll be actually having the prostate gland. But right now we don't have to go into those details of which surfaces and all. What is important for your PGME exams is about the interior of the urinary bladder. Inside the urinary bladder, you'll be having a structure which is nothing but the trigone of urinary bladder, and there are so many questions asked like in and around the trigone of urinary bladder, guys. So let us basically discuss about the interior of the urinary bladder. So suppose if this is the urinary bladder here, if you make your hand like this, what I'm going to do is I'm just going to cut that and open up. So once you open up the urinary bladder here I'll be able to see one opening for the ureter, and then one more opening for the ureter on the other side. Both the ureters, the right and the left ureter coming from right and left kidney, and then below here there'll be opening for urethra. So between the two openings of ureter and the opening of urethra, you'll be able to find a trigone of the urinary bladder. So let's see the important points regarding that trigone. So first you imagine this one to be the urinary bladder, and as I told you, near the neck of the urinary bladder there will be prostate gland here, and imagine that to be the urethra. Of course, that is the prostatic urethra. Now what's happening here, there will be a opening of the ureter there. The right and left ureter will open there, and between this ureter, the opening of the ureter and the opening of urethra here, there will be the trigone of urinary bladder. So this is basically referred to as the trigone. Now once I think if you people have seen the interior of the urinary bladder, the entire urinary bladder will be having folds inside. But except for trigone, the trigone will be very much smooth. And even this question was once asked in your exam, what is the reason for trigone being very much smoother there? So what is happening in the trigone region? There will be mucosa innermost one, but submucosa will be lacking there. That connective tissue beneath that mucosa will not be present there. So because the submucosa will not be there, that mucosa part will be directly adherent to the muscular part. And which muscle that you have over there in the urinary bladder? Retrousor muscle. So if that is attached to the muscle part, so there will be no submucosa part present there, so it can form that folds and all. It will be very much tighter or stiffened, leading to that smooth appearance of the trigone, guys. So trigone is actually smooth. What is the reason for trigone being very much smooth here? Yes, why? Why? Because of absence of submucosa. Absence of submucosa layer over here, guys. That is one important MCQ that you have to remember here. So trigone is smooth because of absence of submucosa here. Then the next point that you have to remember. Now what is happening here, if you have got the urinary bladder, both the ureters, the right and left ureter will come and open. Ureter will be ending there itself near the opening. For example, if this is opening for the ureter will just come and end here near the opening. But the muscles present in the wall of the ureter, the longitudinal muscles, the muscles are not stopping here. The muscles are further moving down. Muscles are further moving forward. So ureter is actually stopping there. The muscles inside the ureter are not stopping there. They are further moving ahead. And those muscles which are further moving ahead, they are actually going to form a ridge here, a muscular ridge here. Elevation. Okay. So that muscular ridge is between the two ureters over here, and this is actually referred to as the interureteric ridge. Interureteric ridge. So the name is very much meaningful here, guys. It is actually between the two ureters. That is why interureteric ridge. Fine. And not only that, the muscles are not only going just between the two ureters, the muscles are even moving down also. So the longitudinal muscles of the ureter are also moving down, and they are going to form one more ridge over here. And that is the ridge between the ureter and the urethra, the opening of the urethra here. So that is why, what is the name of this ridge over here? This is a urethric ridge. So there will be between the ureters interureteric ridge, and between the ureter and urethra uretero-urethric ridge. First, learn the another name of this one. The interureteric ridge, this one is also known as the bar of Mercier. It is known as the bar of Mercier. Whereas the uretero-urethric ridge, this is also known as the Bell's bar. Bell's bar. So interureteric ridge, it is also known as bar of Mercier, and whereas uretero-urethric ridge is nothing but Bell's bar. Fine. Now, once you have comfortably learned the names and everything, the another names and all, now you need to learn the reason. Why is that elevation created there? Why is that ridge formed there? Due to what? Remember, this is formed due to the longitudinal muscles of ureter. Longitudinal muscles in the wall of the ureter. And similarly, this is also formed due to what, sir? It is also formed due to the same reason. It is also due to the longitudinal muscles of ureter. They are going to continue forward. They are not stopping there. They are going to continue forward and they are going to form that muscular ridge. Now, after that, one more important thing to remember here. If you look at the apex of this trigone, this is the trigone here. This is the trigone of the urinary bladder over here. Now, if you just look at the apex of the trigone here, near the apex also you'll be able to appreciate one more elevation here like this. And that elevation near the apex of the trigone is referred to as vesicae, uvulae vesicae. So uvula vesicae, you're able to appreciate there near the apex of the trigone. And again, the same thing, you need to learn what is the reason for this one also. Why is that elevation again created there? Uvula vesicae. And that is actually due to the median lobe of the prostate gland. So in males, the median lobe of prostate gland is forming an elevation near the apex of the trigone of the urinary bladder. That median lobe of the prostate gland is going to form an elevation in the apex of the trigone of the urinary bladder, that is known as uvula vesicae. So I hope you are trying to understand here, even though we are studying about the urinary bladder, the interior structure of the urinary bladder, it's like the structures from the other places contributing here. So ureter is actually contributing to for the formation of bar of Mercier and Bell's bar, whereas the prostate gland is contributing for the formation of uvula vesicae. Now similarly, one more thing, what is going to happen? Will this trigone stop here only? No. The trigone, that elevation will further continue down into the urethra also. The trigone, the muscles of the trigone will not stop there. The muscles of trigone will also continue down into the urethra. Of course, which urethra? Prostatic urethra. So in the wall of the prostatic urethra, the muscles of trigone are going to form an elevation, and that elevation is actually referred to as the urethral crest. Urethral crest. And again, the same thing here, you got to remember what is the reason for this one. Why is that crest? Why is that ridge of the muscle created there? It is due to which muscle? Again, it is not due to the muscles of urethra. It is the muscles of trigone. So this is due to the muscles of trigone. So trigone, the muscles of trigone are not going to end in the urinary bladder itself. They will further continue down into the posterior wall of the urethra, that is prostatic urethra, and that is going to form an elevation there. And that elevation is known as the urethral crest. And that urethral crest is due to the muscles of trigone. So the muscles of ureter are going to form the Bell's bar and bar of Mercier. Median lobe of the prostate gland is going to form uvula vesicae, which is an elevation near the apex of trigone. And the muscles of trigone themselves are going to continue down into the urethra to form urethral crest, guys. So these are the important points that you have to remember about the interior of the urinary bladder. These are the questions which are being asked where most of the students are confused. Now, once you are comfortable with the interior of the urinary bladder, let us now learn about the nerve supply of urinary bladder. There are certain questions asked regarding the nerve supply of urinary bladder also. Obviously, urinary bladder will be under the control of your autonomic nervous system. So we have to see the sympathetic component and the parasympathetic component supplying to that one. So again, let us draw one schematic diagram here. Imagine this one to be your urinary bladder here. followed by urethra. And in this urethra, we'll be actually having the sphincter. There will be internal urethral sphincter, just for the sake of imagination I'm drawing here, and there will be external urethral sphincter here, guys. Just an imaginary diagram, I'm telling you again and again, schematic diagram. So internal urethral sphincter muscle, and this one is the external urethral sphincter. And of course, in the urinary bladder or in the wall of the urinary bladder, you'll be having detrusor muscles. In the wall of the urinary bladder, there will be detrusor muscle, and then urethra will be having internal urethral sphincter, and then there will be external urethral sphincter muscle. Now, once you are comfortable with this one here, let us first of all see the sympathetic component, then later on we'll see the parasympathetic. Sympathetic nerves, we all know very well, guys. Sympathetic will be like thoracolumbar outflow. Thoracolumbar outflow like T1 to T12 and then L1, L2. Thoracolumbar outflow. And out of that, remember, only from T11, T12 and then L1 and L2. These are the segments which will be contributing for the nerve supply to your urinary bladder. So T11, T12, L1 and L2, from all of them, the nerve fibers are going to contribute to that hypogastric plexus. And then from there, the nerve will be actually going and supplying to the muscles of detrusor muscle as well as the internal urethral sphincter muscle. So that is about the sympathetic component. Now, what about the parasympathetic nervous system? Parasympathetic nervous system is the one which is craniosacral outflow. It is from the cranial nerves 3, 7, 9, 10 and the sacral. So obviously we are speaking about the urinary bladder. The nerves should be definitely from the sacrum part only. So sacrum, that will be S2, S3 and S4. Now from this, again the same thing here, from S2, S3 and S4, guys, the nerves contributing to the plexus there, hypogastric plexus, and from there again the same thing, it will be supplying to the detrusor muscles as well as the internal urethral sphincter, guys. And this one will be the parasympathetic component, which will be contributing to the nerve supply for urinary bladder. Now, once you have understood the supply, it is coming from which segments. Now, the important thing is what will be the physiology. I mean to say the action here. It's so simple. Out of those two systems, recall from the physiology, guys, sympathetic and parasympathetic, we know very well when the sympathetic nervous system is activated. I mean to say, like most of the time, we'll be giving the example from first year MBBS, like a dog running behind you and you are like running. At that time, sympathetic nervous system will be activated. Now, if you just keep that example in your mind, think when the dog is running behind me, will I think of, stopping there, just chill and let me just urinate now? Will you think of urination? No. So there will be no urination when sympathetic nervous system is activated. On the other hand, parasympathetic nervous system is like rest and digest, and you want to do everything possible in the world now. So urination will occur when parasympathetic nervous system is activated. So if you just keep this thing in mind, it is very simple. When parasympathetic nervous system is active, urination will occur. When urination will occur, you need to contract the detrusor muscle and you need to relax the internal urethral sphincter. It's actually helping in emptying the urinary bladder. On the other hand, sympathetic nervous system, when sympathetic nervous system is active, are you thinking of urinating? No. So therefore, the detrusor muscles of the urinary bladder has to relax and then this sphincter has to be closed. It makes sense. Don't try to mug up everything. Try to make a concept behind that one. And same old examples. Simple way to understand. Now, this is all under the control of autonomic nervous system. Like, is there anything in our control like somatic nerve? Yes, of course. The external urethral sphincter. Now, external urethral sphincter will be supplied by a separate nerve. That is the nerve again coming from your S2, S3, S4 only. And that will be actually the nerve coming and supplying to the external urethral sphincter. And this is the pudendal nerve. And remember, pudendal nerve, it's actually a somatic nerve, sir, controlling the external urethral sphincter, and that is like voluntarily controlled by the somatic nerve, that is pudendal nerve coming from S2, S3 and S4, guys. I hope the nerve supply to urinary bladder is like crystal clear here. Perfect. So that is about the interior of the urinary bladder, the important points to remember, and even about the nerve supply of urinary bladder. Now, after completing this topic, let us move to the next topic, that is urethra. There are like so many questions asked about the urethra, guys. prostatic urethra, membranous urethra, the penile urethra, like how it looks like in the transverse section, which is the most dilatable part, which is the widest part. All these points are asked. So let us see all those points and let us just wind up this topic now. So first of all, the male urethra will be approximately like 20 centimeters long, and it will be having like three parts. Number one, there will be prostatic urethra passing through the prostate gland. Number two, we have got the membranous urethra. It is the one which is going to pass through the deep perineal pouch. And number three, we have got the penile urethra. Penile urethra. So prostatic urethra, the membranous urethra, and then the penile urethra. I told you the male urethra will be like 20 centimeters long in total. Now first try to learn their approximate lengths like of each and every part. Prostatic urethra will be almost 3 centimeters long, whereas membranous urethra will be 1.5 to 2 centimeters long, and then penile urethra will be 15 centimeters long, so it is the longest one. So prostatic urethra will be 3 centimeters long, membranous urethra approximately 2 centimeters, and then finally penile urethra will be 15 centimeters, adding up to approximately 20 centimeters, guys. Now out of these three, remember prostatic urethra is the most dilatable. It is the most dilatable and widest of all the three urethra. Whereas membranous urethra is the one which is least dilatable and the narrowest. So out of all the three parts of the urethra, that is prostatic urethra, membranous urethra and penile urethra, prostatic urethra is the one which is most dilatable and the widest. Membranous urethra is the one which is least dilatable and the narrowest. Perfect. That is one important point that you have to remember. Then after that, we need to see about the cross sections. That is important. How these are appearing in the cross sections now. Remember the cross sections of the prostatic urethra, membranous and penile urethra. Let's see all of them. Prostatic urethra in the cross section, it will be like horseshoe shaped, or we can say semilunar. So in the cross section, the prostatic urethra will appear like semilunar, or we can say horseshoe shaped. The important one which has been tested a lot of times in your exams will be membranous urethra. In the transverse section, membranous urethra will appear like star shaped in the cross section, membranous urethra. Now when it comes to penile urethra again we can further divide in the bulb of the penis, bulbar urethra, and then the remaining will be the spongy urethra and all. So we can further again divide this penile urethra into the one which is present in the bulb will be bulbar urethra, and the remaining in the penis will be the spongy urethra, and even the terminal part of the urethra, the last part, the terminal part of the urethra where it opens into the glans penis. When you see it in the cross section, bulbar urethra is the one which will be trapezoid in shape. Bulbar urethra will be like trapezoid in shape. The spongy urethra will be horizontal slit like a horizontal slit here, whereas the terminal part will be actually like a vertical slit. Guys. So bulbar urethra will be actually trapezoid in shape, whereas the spongy urethra will be horizontal slit like, whereas the terminal part of the urethra will be vertical slit like. So this is some information that you have to memorize, and you have to remember that a lot of questions are being asked about the dilatable part, the widest, narrowest, and how they look in the transverse section, guys. That's something really important. Now apart from all this information, you also have to learn in detail about the prostatic urethra. There are like certain important things to be seen in the interior of the prostatic urethra. So what we'll do here is, for example, urethra is a tube-like structure. We are going to open up that prostatic urethra. We are going to take a coronal section. So once you take a coronal section, once you open that, you will be able to see the posterior wall. Just try to recall, few minutes back I told you very clearly, there will be urinary bladder, and just on the posterior wall of the urinary bladder, you will be having trigone, and trigone is not stopping there, trigone will continue down, and that will continue down as an elevation on the posterior wall of the urethra, that is known as urethral crest. I repeat again, in the urinary bladder, we actually have trigone, and the trigone will continue down, and that is actually going to form the urethral crest. So let us see the interior of the or the internal structure of the prostatic urethra. So prostatic urethra. For example, if this one is a prostatic urethra and we have actually opened up that one, so that is a prostatic urethra, we have opened that and we are actually seeing the coronal section of that one. So basically this is nothing but the posterior wall of this prostatic urethra, and on either side you'll be able to appreciate the prostate gland present here. Now on the posterior wall, first of all, you will be able to find that there is a thickening, there is a ridge, elevation known as the urethral crest. This is urethral crest. And already we know what is the reason for this elevation here, sir. It is due to what? That urethral crest is due to the trigone muscles, the muscles of trigone. The trigone of urinary bladder is not going to end in the urinary bladder itself. It will continue down into the urethra, and that is the one which is going to form the urethral crest. But in the middle part of that, you can see it is more wider. That urethral crest is more wider. And that wider part here, it is known as the seminal colliculus. That seminal colliculus itself is known as the veromontanum. Veromontanum part. So that there will be a urethral crest, and that urethral crest will be becoming like more wider in the middle part, and that is known as the seminal colliculus. And seminal colliculus itself is known as the veromontanum part. Now on that you will be actually able to appreciate the prostatic utricle. You will be able to appreciate the prostatic utricle. Now what is this prostatic utricle, guys? Try to recall from the embryology part. Prostatic utricle is actually a remnant. In males, it is representing the remnant of Mullerian duct. Normally, Mullerian duct is the one which is going to form female genitalia. Mullerian duct is going to form female genitalia. So, what should happen in the male? In the male, the Mullerian duct will be actually degenerating. I mean to say it is remaining as a remnant here. And that remnant is nothing but the prostatic utricle. So, prostatic utricle is the remnant of Mullerian duct. I hope you all know very well the another name. It is also known as the paramesonephric duct. That is prostatic utricle. And on either side of this one, you'll be able to appreciate openings of ejaculatory duct also, guys, here. So these two will be actually the openings of your ejaculatory duct. And we all know very well, ejaculatory duct is actually derived from where? It is derived from the Wolffian duct in males. So Wolffian duct is going to form all that seed structures. Mnemonic for that is to remember seed, and one of the E stands for ejaculatory duct. So that is derived from Wolffian duct. Hope there is no confusion. I'm just writing this embryology part wantedly over here, guys, so that you'll be able to correlate from the videos or the lectures that we have done based on embryology. Okay. So prostatic utricle, it's actually a remnant of Mullerian duct in males, and ejaculatory duct is actually derived from the Wolffian duct, which is also known as the mesonephric duct only. Apart from that, whatever space that you are able to appreciate that on the either side here, in that space, actually that is referred to as your prostatic sinus, and the prostatic sinus you'll be able to find like many openings here, and these will be actually the openings of your prostate gland only. So first, let me write down the name of this space here. This space is referred to as the prostatic sinus. This space is prostatic sinus, and there you'll be able to appreciate the openings of prostate gland, guys. Openings of prostate gland itself. So these are all the important things, all the important things that you have to remember about the internal structure of the prostatic urethra. That is about the prostatic urethra on the posterior wall. So even like many questions are being asked from here also. So I want you all to remember. So out of the three urethra, all three parts of the urethra, that is prostatic urethra, membranous urethra and penile urethra, apart from learning all those simple stuff like narrowest, most dilatable, least dilatable and all, you have to remember about the internal structure of the prostatic urethra, that too on the posterior wall. So urethral crest, the seminal colliculus, also known as veromontanum, and then the prostatic utricle, ejaculatory duct, and finally the openings of the prostate gland in the sinus. Perfect. So that completes about the urinary bladder as well as the urethra that you have to remember here in the pelvis and perineum topic, guys. That's all done. Thank you.